Hey guys, I am Dr. Gretchen and I am a pelvic floor physical therapist with Breakfreept Pelvic Health and Wellness. And what I want to talk to you guys about today are some different types of urinary incontinence. So most commonly there is stress urinary incontinence, and that is whenever we have urinary leakage with coughing, laughing, sneezing, lifting, jumping, running, or any type of exertion. And what happens with stress incontinence is it's an increase in intra-abdominal pressure onto the bladder, the urethra, and the pelvic floor. So what happens with that big increase in pressure, either the bladder is too full or the pelvic floor is really weak and can't withstand that increase in pressure, which results in leakage. So what we attack this very differently, and specifically with pelvic floor physical therapy, because there are some people that do have pelvic floor tightness that's causing some of their stress incontinence. So again, it's not just a Kegel prescription for stress incontinence. And these muscles have to be strengthened specifically depending on what's causing the stress incontinence. And another really important thing to think about is if you are having leakage standing and coughing and laughing and sneezing, or with jumping or with running, either sitting and doing Kegels or laying on your back and doing Kegels is not going to functionally fix the urinary incontinence. So we like to strengthen in standing, we like to add in jumping movements, we like to strengthen the pelvis, the hips, the core to support the body during those movements to prevent that increase in intra-abdominal pressure, which the bladder and pelvic floor cannot withstand due to weakness or an imbalance there. The other type of incontinence I want to talk about a little bit is called urge incontinence. And that is where you are going about your day, or there's a trigger like running water, where you get an immediate urge to go to the bathroom and you can't make it in time, and the result is urinary leakage. With this type of leakage, sometimes the bladder is involved itself with poor bladder habits, with how often you're going to the bathroom, with going to the bathroom just in case. Sometimes what you're drinking can affect this. So we really look at the habits of the bladder when we look at urge urinary incontinence, as well as the pelvic floor. Again, sometimes the pelvic floor is too tight, which is giving that sense of urgency, and it's not a true contraction and stretch of the bladder. So again, with urge urinary incontinence, we don't normally prescribe Kegels until we look at the pelvic floor and determine that it truly is weak. And many times once we fix the habits of the bladder, that significantly improves the urinary incontinence without doing a single pelvic floor contraction.